We're here with Professor Porter talking about 10 years of value-based healthcare. We have a value-based healthcare center, Europe, for now 10 years. We want to thank you so much for all your help over the years, not just the cases, but all the other information that you've given us to help with the prize. That has been wonderful. If we look at the last 10 years in value-based healthcare, what do you think have been our most important achievements in the whole world?
Well, I would say that value-based healthcare now, over the last 10 years, is now become widely understood. And I think that there are very few people in healthcare that haven't encountered the idea of value-based healthcare. And I think there's just a widespread agreement that as an overall philosophy and definition and framework, this is where we have to go. The challenge, of course, continues to be, how do you do it? It's hard. And that's because healthcare delivery is complicated. And there's just massive complexity in terms of the nature of the disease, the nature of the problem, the co-occurring conditions, and so forth. So I think I think the idea is now well established. A lot of the key concepts are well accepted. Now the struggle is to accelerate implementation. And there's an inherent conservatism in healthcare. We don't want to try things that, unless we're pretty darn sure they're going to work. And we want to go slowly, and we want to go carefully. And I think physicians in particular are always good at thinking of the exception. They're always thinking of the thing that we didn't think of that might actually, turn out to be a negative. So I think now the big challenge is really implementation, not so much the selling of the basic idea. I think the exciting proliferation of examples is now, I think, very widespread, and we can find examples all over the world and in many different ways across the whole value-based healthcare agenda. The literature in medicine and in healthcare is now very, very full of work and research on value-based healthcare. So all that is helping to codify and show how this actually works. I think the big challenge we have now is scaling. I think we've had a lot of great experiments. A lot of them have been very successful. A lot of people are very excited about what they're getting, but how do we kind of bring this to scale? And that's where I think we're going to need some new actors to play a bigger role. Governments have been supportive of value-based healthcare, but ultimately they've been less willing to take steps like you must measure outcomes, or we are going to move to value-based reimbursement on this time scale. So I think scaling the implementation is going to require more payer mandates than we've been sort of comfortable with so far, but I think the time is coming when that is going to happen. I think we're starting to see the technology industry supplying healthcare to start to change its model to reflect value-based healthcare. We have a very, very exciting case from Medtronic, the #1 medical device company in the world, really moving to value-based healthcare models of how they deliver their service. And as you know, Medtronic actually bought diabetes, which is a famous example in the Netherlands, because they believe that for a complex chronic condition, you really have to control the IPU if you're going to maximize the development of care. And so they decided just to go into that business. They've also got some whole new payment models where they're taking risk on outcomes and really guaranteeing outcomes in the payment model. And we're seeing that in the pharma industry as well. So I think what's very, very exciting is that not just the providers have started this journey, but we're now starting to see it move into the supporting industries and supplier industries, and I think that will just speed up the whole dynamic of care. And so I think that's where we're going probably next. And Europe has become, one of the leading places in the world for innovation in healthcare. And I think that's partly because of the wonderful work you've done at the center, partly because in Europe they didn't have a big debate over whether there should be mandatory coverage and a lot of the issues we've been, hung up with here in the United States. I think Europe has been in the lead. And so we so appreciate in the value-based healthcare movement what the center has been able to do, and the tremendous number of organizations in Europe that have become some of the leaders in the world in this field. And of course, we have a special feeling towards the Netherlands as a country that has in a sense now put itself in the position where it can be legitimately claimed to be the most innovative country in value-based healthcare. So I think it's been a great 10 years. There's a lot of work, though, to be done.